nerve root compression. That is, if both nerve roots are compressed and if the patient has pain on both limbs or any kind of a numbness with radiculopathy, what we do is, by the same approach, we can dissect the opposite side. Welcome back to Nextgen Neurosurgical channel, and my name is Dr. Anil Weerasinghe. I'm one of the assisting neurosurgeons at Lanka Hospitals attached to Next Generation Neurosurgical team. Today I would like to talk a little bit about the surgical technique laminoplasty. Laminoplasty is done for patients who has back pains and radiculopathy, which is pain running down your lower thighs to the lower legs, and also which even has numbness. So I will not go into very much with medical details, as it will confuse our patients who are not from a much of a medical background. So I would like to just say what we do by laminoplasty. So if you have a problem with your back, that is, after doing a scan that you find out that your spinal cord or the nerve roots are compressed, that is following an MRI scan, so we offer you the technique of laminoplasty, which is a minimally invasive technique, which we make a cut of less than 1 inch, and with dilators we go in, and then through a microscope we do the dissection. So in the dissection, with using a drill, we make a small hole on the lamina, and then we approach the next level, which is a ligament, and we remove the thickened ligament with some Kedis and Rongers, and we do a micro dissection, and then we approach to clear up the nerve root, and we remove all the bones which are impinging on the nerve root, and also the thick tissues around the nerve root. And then if the discs are also impinging or compressing the nerve root, we do a microdissectomy, and thereby the nerve root gets cleared, and also the spinal cord, the thecal sac we call in medical terms, also can be decompressed. And if they are a bilateral nerve root compression, that is, if both nerve roots are compressed and if the patient has pain on both limbs or any kind of a numbness with radiculopathy, what we do is, by the same approach, we can dissect the opposite side, which means there is less trauma to your bony structures and also to your muscle structures. So the recovery of the patient is really fast. Sometimes on the same day evening, patient can be discharged, go home, or the next day morning they are being sent home, and they get back to their normal working lives the next day itself. So there's not much for patients to be worried about this procedure. It's not like the olden days where we make a huge cut and we go in and we remove the whole spinous processes or the whole bones, and where the patient has to stay in hospital more than 3 days. So this is what we offer at Nextgen Neurosurgery. Thank you.